I'm so excited to talk to you today about how the health of an organization and the health of the individual align and how many similarities they both have. My name is Karla Cauldwell. I am a nurse health coach and the leader of the Whole Life Healing Framework. All right, so let me tell you a story. 2 years ago, I was sitting in a meeting I didn't want to be in. It was mandatory. And so I was multitasking, half listening. It was all about how to be a high reliability organization. So I'm multitasking, not paying attention. And then all of a sudden, I heard something. I heard sensitivity to operations is the principle that takes us out of autopilot and puts us in the moment so we can observe what is happening in the workplace and become aware of potential gaps and opportunities. Oh my gosh, it was so funny. I yelled out, "That's mindfulness." I got so excited, and all of a sudden, I was all ears, all eyes. I was fully engaged in the presentation. I could not believe that what they were talking about for becoming a high reliability organization had direct parallels to what I was teaching to our clinicians and to our patients about how to be well. They were describing mindfulness, which is foundational for being healthy. In order to prevent over 75% of dis-ease, we must learn to self-manage. And key to self-management is the act of mindfulness, the ability to be here in the moment so we can self-assess and learn about ourselves and identify ways that we can improve our own health. Oh my gosh, so excited. So, what I want to talk to you about today is I'll briefly go over what a high reliability organization is, what that framework is, and I want to lean into one of the five principles, which is sensitivity to operations. And then I want to talk about how does that line up with being a healthy healthcare staff and being a healthy patient, and why aligning those three pathways can help us to change our culture to one of prevention. So, moving away from reactionary medicine to one of prevention. And I really hope you get just as excited as I am. And I hope that you will apply these principles to your own work life and to your own health and share them with others. Okay, so I'm going to try to keep it simple because I find that the simpler we are about our health and about organizational health, the easier it is to get there. The complicated, all right, I won't get into it. So, high reliability organization, what is this? Well, you might already know, you might be living it in your organization because it is one of the most popular frameworks for organizational health and success. Companies like um, Southwest Airlines, and then in the healthcare industry, large healthcare organizations like the Mayo Clinic, the Cleveland Clinic, John Hopkins, the Veterans Health Administration have adopted the High Reliability Organizational Framework. The acronym's HRO. What does it mean? It means that a high reliability organization is an organization that operates in high stake environments, complex environments, high pressure environments, to consistently avoid catastrophe and failure, even when the conditions of failure are present. So it is a framework that helps improve safety. It helps improve outcomes. It reduces errors all the way from small to large. Large, by large, I mean fatal. It improves outcomes and efficiency. I think I said that again, but it's worth saying again because it's so big. And it unifies the organization to be and do better from the individual to the whole group. Okay. And I wasn't excited about this before. I was like, high reliability, whatever. I focused on prevention and health. What I didn't understand is that the same principles for being a high reliability organization, I can find a matching principle for prevention with health, with employee health, and with patient health. So, why did I get so excited? I got excited because thus far I had been working on helping my organization realize that patient health and employee health are the same. And when we use separate systems, it makes it difficult to achieve the ultimate outcome of becoming a preventative organization. So I had been trying to align the same principles that create health for our patients are the same principles that create health for our employees. What I discovered that day 2 years ago, that the same applies to the health of the organization. The same principles that create health in the organization are the same principles that create health for the healthcare staff, are the same principles that create health for the patient. Why might we want to align the three? Because they're more powerful together. We have people working for this one, and this one. And if we all unite, it makes us more powerful. Because right now, as it stands, these are separate entities floating around, being proposed. And there are three separate groups that understand the importance. And if we can unite the three, we create a more powerful movement. So I want to bridge the gap between all three. What we are managing in outpatient healthcare, 75% of it or more is preventable. So we need to empower not only because our staff are also experiencing these preventable health conditions. So we need to educate, empower, and equip our veterans and staff with the skill set to prevent. What's awesome is that those same principles apply to what makes the organization healthy and successful. So if we start to connect the dots between the three, we're more likely to have success with all three areas. I want to focus today on one of the principles of being a high reliability organization. I want to focus on sensitivity to operations. I'm going to define it and then give practical examples of how you see this in your organization. And then we're going to talk about how it aligns. What's the aligning principle when it comes to prevention with our healthcare staff and our patients? Okay, so sensitivity to operations is about closing the gap between what we imagine our work is, what we imagine success of the organization is, to the work that's actually being done. Sensitivity to operations is the principle that proposes let's get out of autopilot and witness things in real time, because that's when we will identify potential gaps, areas of improvement. This is mindfulness. So, mindfulness is going to be the word that aligns the principle of sensitivity to operations for organizational health and success, and the principle of healing for our healthcare staff and our patients. Mindfulness. And defining mindfulness just means the skill to be in the moment, not in the future, not in the past. It's the ability to be here now so we can assess things as they are. What this looks like in a healthcare organization is taking the moment to look at different procedures. Like, for example, if we were to look at whatever process is at your organization for prescribing a medication, ordering it, administering it, and noticing the flow and identifying any areas where there's room for error where we might be able to improve. With safety, it's looking at our environment in the organization and noticing potential areas where that might be unsafe so that we can fix it. It also might look like assessing a healthcare staff member who has particular duties and noticing, are there ways this person could change the way they're doing this task, like physically, so that they can prevent injury? And then creating a protocol for every healthcare staff that has a similar role so that they will prevent injury. I hope that makes sense. Now, how does this look when we look at healthcare staff health and patient health? How does sensitivity to operations, and the word that connects all three of these is mindfulness? How does being in the moment, our ability to self-assess right here, right now, how does that look with healthcare staff and our patient staff? What that might look like is learning to pay attention to the body with food. So let's say we encourage our staff or our patients to keep a food journal for the week and to take notes on paying attention to how foods react in their body. They are the experts of themselves. If they learn to be mindful and pay attention to the moment, they can start to notice which foods help them, which foods hurt them, so that they themselves can take empowered action to eat more of the foods that help and less of the foods that don't. What is another example? Exercise, movement. So paying attention to which forms of exercise help and which ones don't. So I hope this is making sense. It can be applied to anything. This sensitivity to operations, mindfulness can be applied to any aspect of health, sleep, paying attention to stress. This is hugely helpful for our organization, for healthcare staff, for patients to pay attention, because we are more likely to make changes when we ourselves notice, not when we're told, when we notice. I just get so excited about this. And how this applies across the board is understanding that it is important to teach mindfulness to our staff so that our organization can be healthy, because it's an important skill to have for that sensitivity to operations. And it's so important for our healthcare staff to empower and equip themselves to be healthy, and then to teach this to our patients because they need this skill too to be healthy. So now we can place importance on mindfulness and begin to make it a part of our meetings, our emails, our patient visits, our employee wellness program. Teaching mindfulness might look like teaching having breathing exercises. Breathing exercises help us to be in the moment. Having mindful moments, like teaching meditation and mindfulness, and then sharing with our staff how this benefits the organization. When we build that skill set, when we strengthen our ability to be in the moment, we're more likely to be more efficient for our organization, to have better outcomes, to be safer. When we increase the ability to be mindful, build that skill set when it comes to our health, we are more likely to make choices that benefit our health. We are more likely to notice when we're not doing well and start to assess, what can I do better? When we become good at being mindful, we're more likely to teach it to our patients because we see the value. So I hope this is making sense. That now we're looking at these three different areas and we're taking one skill, the skill of mindfulness, and applying it to these three different areas. So, what might happen? What might happen if we start to make the connection of the organization, healthcare, staff health, and patient health? What this might look like, let me give an example. So, let's say that a nurse leader has been practicing mindfulness. She understands that mindfulness is important, not only for the organization's health, but for her own health, and also to role model it to her staff and patients. So one day, she is doing her mindfulness practice. She's taking a moment before she starts her workday to check in and assess how she's doing. She notices that she feels really tired and low energy, and her mind's a little fuzzy because she hasn't been able to sleep lately. So she has noticed that. And now, when she's meeting with her staff and they're having a huddle, she tells her team, I'm feeling depleted today. I'm feeling tired. So I need us to have extra communication so we can all do better. If something feels off, please let me know right away in case I've missed something. How powerful is that? Um Let's unpack that, what this nurse leader just did, because she has practiced mindfulness. She understands sensitivity to operations. She's let her team know. She's asked for help. This, it contributes to a safe environment. It gives permission and role models to her staff to self assess themselves and to speak up what they need so that the team can work together in the best way possible. Oh my gosh. I just get so excited at the potential. So, what can we do with this? Now that we've talked about this, if you see the value, you see the connection between the three areas, what can you do now? Most importantly, you can start with you. You can start with building your mindfulness practice. And the good news is that mindfulness, you can practice that in so many different ways. It doesn't have to just be meditation. Not everyone is drawn to practicing meditation. Some people find it difficult, although that's the whole point. It's very difficult to focus in the moment. So if you do adopt a meditation practice, you're taking time to practice keeping the mind here in the moment. And anytime the mind wanders, and it will, that's normal, we bring it back to the present moment. So you might choose to have a meditation practice. You might choose you want to go the mindfulness route where you're going to practice doing one thing at a time. I think one of the best mindfulness practices is mindful eating. We all have to eat. And all this means is that when you eat, that's all you do. You're not looking at your phone. You're not talking to your friend. You're not trying to do work on the side. You're sitting, eating your food, chewing, paying attention to all the sensations, keeping your mind on this moment, on your food. And when the mind wanders, and it will, that's normal, you bring it back to chewing your food. You can also apply mindfulness to any ordinary task, like brushing your teeth, making the commitment that I'm going to focus on brushing my teeth. Anytime my mind wanders, and it will, that's normal, I'm going to bring it back to brushing my teeth. And that's going to be my mindfulness practice. You can practice breathing, uh, picking any breathing technique you like. It doesn't even have to be a technique. You can say, I'm just going to focus on my breath for 2 minutes, meaning that you're going to pay attention to the inhale and the exhale. Inhale and the exhale. And as a reminder, we're practicing mindfulness. We're getting better at mindfulness because when we're better at being mindful, we're more likely to come to our work and be in the moment and observe things as they are. And when we see a gap or a potential for a, an accident, or we witness a safety concern, we can work on improving. We can speak up. When we're good at mindfulness, when it comes to our health, we're more likely to collect data from the most important place of all, ourselves. We're more likely to notice what helps our health, what hurts our health. And when we're more mindful, we're more likely to make choices that support our health and well-being. When we improve our mindfulness experience, we see the value, we see how it helps us better self-manage. So we're more likely to role model it with our staff and patients. We're more likely to encourage our staff and patients to practice mindfulness themselves. Another thing you can do. So step 1 is you want to start with you and practice mindfulness and share it with your staff, share it with the patients you take care of. Number 2 is you want to make the connection. I want to invite you to make the connection. So after I understood that all of this aligns, what I try to practice is when I'm in my work setting, I try to be in the moment. I try to stay out of autopilot and I try to be in the moment so that I can see if there are any opportunities for improvement, any gaps, any potential safety, any risks. When I'm thinking of my own health, I do my best to be in the moment and pay attention to my own mind, my body, my emotions, and apply that information that I'm gathering to make better decisions for my health. In my practice of my work with patients and healthcare staff, I do my best to role model and to encourage these practices and support my staff and my patients to do better in this area. I think it's important to be repetitive, and I think it's really important to point these things out. Anytime if you are in a situation where you are in a huddle, where you are speaking to a patient, point this out. Point out the opportunities for mindfulness. And when you're in a staff setting, an organizational health setting, making that connection with the group of this is sensitivity to operations, this is why it's important, and this is how it connects to our health. This is the connection in our health. When we are focusing on mindfulness for our health, we make that connection of this is how it relates to organizational health so that we can create those new neural pathways back and forth between what is good for our organization to be well is the same as what works for our individual health and our staff's health. I hope you're excited. Will you reach out to me if you have any questions or you're seeing any gaps in the way I'm presenting this material? Please let me know so that I can do better and we can have a joint discussion. And please let me know if you decide to implement anything we talked about today. I am rooting for your success times 1,000. And I'm just so grateful to you for being a part of healing healthcare. If you found this helpful, please share this out with any colleagues that would benefit. Thank you so much. And I hope you have an excellent, excellent day. Thank you.